I'm Robyn Blythe. I'm a licensed clinical social worker and clinical director at Ventura Recovery Center. EMDR, it is a modality that treats trauma, and it stands for eye movement desensitization and reprocessing. And what it does is it stimulates both hemispheres of the brain by moving the eyes back and forth, or you can do it through audible on each side of the head because it still stimulates both hemispheres of the brain. I also have tappers that you can hold in one hand, actually in both hands, where it vibrates in this hand and then this hand, also stimulating both hemispheres of the brain. They find by stimulating both hemispheres of the brain that it puts the body in a very relaxed and calm state. And it also helps to reprocess trauma. Trauma is experienced usually in early childhood. It can also be experienced in war, times of war, and seeing a catastrophe. It's actually having some sort of assault that happens to the well-being of the system of the human being. And because of that assault, it can create symptoms of post-traumatic stress disorder, which include nightmares, flashbacks, anxiety, and intrusive memories. And it also makes people avoid people, places, and things that remind them of the trauma. Traumatic memories get lodged in a different part of our brain than where our regular memories get stored, which is back here. So the traumatic memory is always trying to reprocess itself in order to find its way back into where these memories get stored. So what happens, though, is that in the course of time, that trauma has left a neuronal imprint, I should say, so that the person begins to see their life and situations in their life through the lens of the trauma. So they're not really seeing life in reality. They're seeing it through that lens of the trauma because of that traumatic memory. Now with EMDR, what we do is we bring up that traumatic memory in a very safe environment. I would say over 90% of the clients that come into Ventura Recovery Center and most rehabs, they suffer with trauma. And what happens with addiction is that people, when they're experiencing the symptoms of PTSD or the anxiety, they numb out that with their drug of choice or with their alcohol. And so they end up getting into a very numb state and never really dealing with the feelings of that trauma. And so what happens is that trauma then gets stuck in the body. And the body-mind connection is so powerful that once that trauma gets stuck in the body, it starts to create even more symptoms. And what the EMDR does is it helps to reprocess those feelings in a very safe way. So it ends up feeling more, the person ends up feeling more empowered in their life, more wisdom, more compassion for others as well as compassion for themselves. And they end up having this divine wisdom that we all have. That's a major component of EMDR, is the concept that we all have a well-being, a divine wisdom inside of us that gets blocked by the trauma. And so with addiction, what we do is we look at what's the underlying issue to the addiction, which oftentimes is the trauma, and then we go in and we clear out that trauma, and the person no longer feels the need to numb out the symptoms because they're no longer there. So we can also look at what's the charge that the client gets from using or from drinking. What is that charge? And then we can go into that charge and be able to shift it to where they no longer are aware or experiencing the thought of that charge in the addiction. And then we can look at how good does it feel to be sober and clean. And then I'll do some EMDR around that to make that feeling even that much more solidified in their day-to-day functioning. EMDR offers the client amazing hope in the fact that they no longer have to use their drugs of choice in order to numb out their pain. EMDR also teaches amazing coping tools and strategies and mindfulness techniques that people can use on a regular basis. So if they start to feel even a twinge of anxiety, they now have so many tools available for themselves to be able to manage feelings and have a mastery over their experience versus having their experience or their emotions having a mastery and imprisoning them to the point where they relapse or they have to use the drug once again to numb out. So that's the beauty of EMDR, is it does have lasting effects. It's forever. And I'm never ceased to be amazed again by the effectiveness of this amazing modality to cure PTSD and really, really clear out trauma.